You're tuned to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partners Podcast. We are also on Spreaker, so look us up on that, on different podcasts besides Talk Radio on iHeart. Today, Jeannie Roller, my co-host, has got the day off, so Jeannie, kudos to you. Misty Roberts is a person that Jeannie Roller and I met quite a few years ago when we had different medical agendas happen to us. And Misty Roberts was a lifesaver to us with her medical patient modesty and patient dignity aspect. Her website is patientmodesty.org. A lot of times, Jeannie Roller and I would say to Misty, we're not sure that patient modesty is the right word. It kind of scares people off because we're really not pushing the modesty type issue. But Misty is very spiritual, very religious oriented. Very caring human being, certainly to spend the time and the effort that she has done in the years that she has started Patient Modesty, the Medical Patient Modesty website, and the whole thought pattern with that, trying to help people, trying to steer them towards more dignified, more resourceful healthcare, if you will. So not any of us to be the ones that want to be the bad guys and say, don't go here, don't do this kind of a thing to certain specific names, rather turn it around the other way and say, these are the positive things that you can do looking for medical care that would most align with your needs. So Misty Roberts, check out her website, the patientmodesty.org website, for different avenues of what you can do to keep your dignity intact in a lot of surgical procedures. Saying that, Misty Roberts has also interviewed doctors who are on the same wavelength. These doctors, orthopedic surgeons, two of them that I'm going to mention their names, Dr. Bruce Levy was at Mayo Clinic, and then also Dr. Scott Trenhall, who's in orthopedics in Illinois, have been concerned about their staff's well-being is also. So think about you as the patient. We're very anxious because it isn't our theater, if you will. It's not our normal. And you are very anxious, scared, whatever word you want to use, petrified, afraid, confused, don't really want to do it. How many people say, I'm not going to do it. I just can't see my way going through it. They also have said, we don't want our staffs to be that anxious, uncomfortable. And you wouldn't necessarily think that because we've often heard, and Jeannie Roller and I have talked about so many times, their mantra, a lot of people is, well, we've seen it all. There's not anything that you're going to present to us that we haven't seen, genitalia-wise, condition-wise, those kind of things. We're medical people. But at the end of the day, are all medical people really comfortable with doing this? Well, apparently, some of these instances, they're not. I mean, medical people are human beings. Doctors are human beings. How much can they take of some of the stuff, too? And if these different garments and these different mindsets make it easier for patients to acknowledge that, yes, there are people that will work with us, that will allow us to wear different medical surgical garments that make it easier, it makes the people comfortable. It makes the people warmer. It makes the patients warmer. Isn't that what you want? You don't want a freezing cold patient. Look at all the levels in your body that's going to skew. Your blood pressure, your oxygen. I didn't go to medical school, but just think about some of it's common sense. So thinking on that, part of the job of the healthcare providers is to ensure patients are comfortable throughout their experience. So privacy garments provide they provide benefits. Patients feel respected. They stay warmer, like I said, in the OR, and they can retain their privacy post-operatively, because here's another key point of this, and you don't often think about that. Many patients have non-spousal assistance after the procedure and right in the after the recovery room, in their room. So wearing these type of garments and having this kind of mindset that this is possible, that you're not everybody's stripped naked and, we've seen it all, so don't worry about it kind of thing. Well, there's a lot of people that are, and the warmer you are, the more comfortable you are, in my opinion, is that you're going to heal faster. Another thing that's an aspect of it is the prevalentness of adolescent procedures. Now, these are people, not that it would be okay for an older person to be in the situation where you're uncovered and you're not, your sensitivity, your dignity, and your modesty should go out the window. But also, a lot of these surgeries are happening to adolescent males and females, and it's a situation that you probably have not been in your life before. So it's even more scary, if you will, that this kind of stuff is happening, and you want to feel comfortable with all of it. A healthcare team can when this happens too, when your patient is more comfortable and more in tune and just eased into the situation, it also makes it easier for the healthcare team to stay focused on the task at hand, and also them worrying about spending extra time, if you will, to negate or counterattack the exposure. Now, sometimes some of the things Jeannie and I have talked about, different places that we've seen ourselves personally, that we've heard from other people that we've interviewed on this podcast, that kind of went out the window, that the patient wasn't really forefront in the surgical procedure. Yes, they are technically, but not that rest of the stuff is under the mindset, well, we've seen it all. What are you worried about? We're medical people, so that doesn't really matter. But it does matter. Absolutely does matter. And there are so many people that are involved in this. Another person that I've spoken with, and she's been on this podcast, is Robin Leonard. And she has been involved with geriatric care and bathing her mom, bathing her, relatives and stuff like that. I mean, it's a very embarrassing situation for both sides. So look her up, Robin Leonard, also with different garments that she has designed. Look up covermedical.com, cover garments that were designed specifically for orthopedic surgeries, male and female, both bras for females, and then the bottom shorts and whatever for both male and female. And talking with the orthopedic surgeons, that's for your hip, knee, whatever. Why does all that have to be exposed continually? Some of the arguments back from the medical staffs are that we have to get to that access ASAP. Well, these garments are specifically designed by these doctors who do these procedures day in and day out and know what needs to be exposed, what doesn't need to be exposed, and how they were designed specifically for that, as well as the material that's used, the sterility and those kind of things. So look into all of that. Emotions dissipate when staff explains the availability of privacy garments. I know one of the instances with Dr. Scott Trenhal in Illinois was with his staff who needed a orthopedic surgical procedure. Of course, that person wanted to go to him because she knew how great of a doctor he was, how successful, how comfortable she felt with him, his knowledge of the procedure, but she was very reticent to have her employer see her in that unclothed situation. And that was one of the reasons why that doctor really looked into it, because she needed the procedure, the surgery to be done, but she kept putting it off and she didn't really want to admit to it that was the embarrassment. So look at that as well. It's called Modison Patient Wear. You can look it up online, Google it online. They have dignity bras, dignity briefs, covermedical.com. Look up patientmodesty.org from Misty Roberts. She's a fabulous person. And look up Robin Leonard. These are people that have helped us all along, and I just want everybody to know it. We can't say it too many times to have this knowledge in your brain that these things are available, and it's not embarrassing, or don't be afraid to ask. I mean, get what you need for the surgery, without being, it doesn't have to be caustic. The situation doesn't have to be caustic. Stay listening to Evergreen Media Network.